It's a painful condition suffered by thousands of people, many of whom do not know where to go for help. The dentist at Dr. Shawn Keller Smiles by Design in Redmond can help not only to alleviate the symptoms of TMJ, but to get rid of it altogether. Please welcome Dr. Shawn Keller and one of his very happy patients, Anna Sabi. How are you guys?
Good.
Doing well? Good. What was going on?
So I absolutely didn't know I had TMJ. My pain started in my neck and kind of radiated down my shoulders. I was having headaches every day. They turned into migraines, which would happen weekly, which are, if anybody's experienced, debilitating.
They're awful. They're the worst. They shouldn't even be called headaches because it's so much worse than that.
Oh, it's a different category.
So did you go through a lot of doctors trying to figure out what the source of the pain was?
Absolutely. I saw chiropractors, massage therapists 2 or 3 times a week, physical therapy. I saw another dentist who suggested pain medication.
Oh my goodness.
Things I would never consider.
Still looking for it. When it came to you, how did you diagnose her and what did you do for treatment?
Well, the first thing we do is a thorough exam. So just by looking at some of her symptoms and looking at her teeth and looking at her jaw joints, I can get a good idea of it. And then we have some other scans that we can do. In about half an hour, I can read the balance of her muscles. And in a moment, we have another scan where you bite into a computer chip and it'll show us how everything is balanced.
Which is so amazing because, you know, people have worked on this forever and now, you know, there really is a way to diagnose somebody's bite and figure out what's going on. So what did you do with her?
After we ran the scans, we decided, yeah, there's a really good chance we can help her. So the first thing we did is we make for her what we call an orthotic. So just like with a shoe orthotic, if you have a leg that's shorter than the other and you put that in, it balances you out and everything's perfect. Same thing with your bite, too. If you've got a bite that's imbalanced, we have a little, very thin, unnoticeable orthotic that you wear. And when you put it in, it balances your bite and it makes the clicking stop.
Wow.
Your muscles are balanced, and then we just kind of wait and see. And usually within a couple of weeks, the symptoms get much better.
So what happened with you?
Yeah, absolutely. I was wary at first to believe that my jaw could be causing all of this
that
pain.
stuff, right?
Yes, but immediately I felt relief, and slowly all the symptoms started unraveling. And really, it wasn't slowly. It was pretty quick.
Now look at the before and after, doctor. It looks like her bite is very different in the after. It looks like her jaw is repositioned.
Yes, well, so let's say you wear the orthotic and things feel good and it works. Then we have some different choices. The first one is you can just wear that long term. Some people, if we decide the teeth have been damaged after a while, then we can reshape or add to the teeth in certain areas to make it a permanent effect.
Which one did you do with Anna?
And so for Anna, we decided that we would do some porcelain veneers in the position that the orthotic was to balance everything out permanently. So now she doesn't need to rely off of this orthotic.
Look, that's like $1 million smile. We have another picture. So are you pain-free at this point?
Absolutely. For 2 years.
Wow.
Pain-free.
I mean, how bizarre is that? Let's talk again about, and we have a little bit of video about how you go about diagnosing somebody's bite.
Oh, okay. So, yeah, this is me. I just did a little clip of
It's good that you did it for yourself.
Me biting into it. So on the computer there, you can see when I bite into that computer chip that different areas will show where it's hitting harder, and it also gives you a percentage of balance. And if it's not 50-50 balance and everything is hitting evenly, there's a really good chance that your muscles are imbalanced, and that will spread everywhere and start to cause this pain. If not now, it could be soon.
I'm so glad you're feeling better.
Thank
that
you.
sounded like a bad ride.
Thank you.
You got